As I show you, we aim to use microbiome as a preventive treatment to improve our survival, to decrease the risk of graft-versus-host disease. But now we are already using it to treat acute graft-versus-host disease, and in particular, some patients with severe refractory GI-aGvHD graft-versus-host disease. And in fact, we are able to treat more than 100 patients, exactly 140 patients within an early access programs in Europe. In this early access program, the patient receives the MAT13 product. So the MAT13 product, this is also a pool microbiome product that is given to the patient as enema. We give 3 doses every 7 days. And we assess the GI acute graft-versus-host disease response at day 28. So to be included in this early access programs, patients need to have some GI acute graft-versus-host disease that are resistant to steroids and also to additional line of treatment, because as you know, now Ruxolitinib is approved in most countries in Europe as a standard second line treatment. So most of the patients are also resistant to Ruxolitinib in addition to steroids, and some patients are also resistant to additional line of treatments, since in fact, the median number of line of treatment given to the patient was 2, but patient received up to 6 lines of treatment before MAT13. All patients have a GvHD resistant to steroids, and 84% of the patients, 121, was also resistant to Ruxolitinib. Almost all patients received the 3 doses of MAT13 that was given by enema. Regarding the response rate, we have a GI response rate of 52%, including 28% of complete response. When we look at the overall GvHD response rate, because some patients have also some skin and liver involvement, the response rate reached 53%. We also analyze the subgroup of patients that receive steroid as the first line of treatment, Ruxolitinib as the second line of treatment, and that were treated with the microbiotherapy MAT13 as the third line of treatment. And in fact, we have a higher response rate in those patients with an overall response rate of 63% and a complete response rate of 49%. Importantly, patients that achieve a response translate into a significantly improved overall survival, being 68% at 1 year in the responding patients compared to the 24% in the non-responding patients. If you focus in this particular subgroup of patients that is resistant to steroids and Ruxolitinib, the overall survival was even higher in the responding patients, being 76 patients at 6 months and 1 year. Regarding the safety, the treatment was safe. Of course, we have some infectious side effect, but that was expected in patients with severe GI acute graft-versus-host disease, and there was no increase in the risk of infectious complications in those patients. So to conclude, MAT13 seems to be a promising treatment for the treatment of GI acute graft-versus-host disease, and it is currently evaluated in the prospective phase 3 RS study that plan to include 75 patients with steroid and Ruxolitinib resistant acute graft-versus-host disease. And so far, we have the 2/3 of the patients that have been treated in this clinical trial with some positive DSMB review. So I hope we'll be able next year at the EBMT to present you the result of the phase 3 study.